Hi, is it Dan?
Yeah.
Hey, my name's Sonny. I'm with Anesthesia.
Hey.
Just some questions for you and do a quick assessment before we head into the OR.
Okay.
What surgery are you having done today?
I had my gallbladder taken out.
Taking a gallbladder, taking that good stuff.
Yeah.
Have you ever had surgery before?
Yep.
Yeah? Any issues with the anesthetic at that time?
Yeah, I threw up a lot.
You threw up a lot,
Yeah,
eh?
lots.
Okay, so we'll try to avoid that this time around.
I actually had to get brought into the hospital afterwards.
You have to come back in afterwards.
I had to stay, yeah, they let me go home.
Okay, all right.
Yeah.
Well, we're going to do our best to try to avoid that this time around.
Okay.
Any family history of any adverse reactions with anesthetics?
Yeah, actually. Something, malignant hyperthermia.
Malignant hyperthermia?
Yeah.
Okay. And how are they related to you?
So actually, I think it was my dad maybe,
Okay.
and his brother.
Okay, and did they have testing for that, or were they just told they may have it?
I think so,
You
yeah.
think possibly,
I think
right?
so, yeah.
Okay, so
I remember
that's-
being told that though, that they had it.
Okay, and then would you know if those precautions were taken with your previous anesthetic?
I don't know.
Not sure. Okay. All right. When did you last have something to eat or drink?
Probably at 10 o'clock last night.
10 o'clock.
Yeah.
Okay. Nothing this morning.
No.
Okay. Do you have any allergies to medications in particular?
No allergies. I think.
No allergies. Okay. And any issues with your heart, high blood pressure? Ever had a heart attack? Anything
Nope.
along those lines? No. Can you walk up a flight of stairs
Yes.
without getting short of breath?
Yeah.
Okay, that's good. Any issues with your breathing?
No.
Asthma?
Nope.
No. Do you smoke?
Like cigarettes?
Cigarettes? Yeah.
No.
No. Okay.
I use
do you-
marijuana.
You use,
Yeah.
Okay, that's where I was going to go there with that.
Okay.
How often are you smoking marijuana?
Like join a day.
Join every day. Okay.
About that.
And you've been doing that for some time now?
2 years.
A few years.
Yeah.
Okay.
Any issues with your thyroid?
Nope.
No. Blood sugars are okay.
No.
Never had a stroke procedure.
No.
And your kidneys are healthy as far as you know.
As far as I know.
Yeah. Do you have any heartburn or reflux?
Nope.
No. Okay, that's good. Any issues with bleeding and clotting?
Nope.
No. Okay. So you already mentioned marijuana. Do you drink alcohol?
Here and there.
How much and how often would you say?
I don't know, once on the weekends, like every week or every other week kind of thing.
And when you do drink, how many drinks do you have in one sitting?
A few drinks.
Three or four?
5, 6.
Okay, so 5 or 6 per week if you were to
Yeah,
add it up.
around there.
Okay. And outside the alcohol and marijuana, any other drug use?
No.
No. Okay. All right. And are you on any regular medications for anything right now?
No meds.
No. Okay, that's good. All right. Can I get you to smell and show me your teeth? Anything counter loose in there? Nope. Can you open your mouth as wide as you can? Stick your tongue out. That's good. Now close your mouth. Head all the way back as far as where you can go. Perfect. All right. You can take your chin and touch your chest just like that for me. All right. Perfect.
All right. So the reason I get you to do that, all that is just so we can have a look at the airway.
Okay.
For this procedure, we are going to have to put like a tube that sits just below your vocal cords.
Okay.
Now, because of that, when you wake up, you may have a bit of a scratchy or sore throat. Okay. And because we're going to be instrumenting with the airway through the mouth, there's a very small chance of dental damage. We're going to do our best to minimize it, but it's something you need to be made aware of.
Okay.
You mentioned the post-operative nausea vomiting, so we're going to do our best to try to mitigate that. But
Good.
because you have that history, you are at a risk of having an issue with that.
Yeah.
And then the other issues with the malignant hyperthermia, we're going to avoid the gas anesthetics altogether.
Okay. You'll still
Okay.
give me something to sleep
So
though,
yeah,
right?
we're putting you off to sleep.
Okay.
It'll just be through the IV. So we'll make sure that we have a nice running IV for you before we head in there.
Okay. Sounds good.
Do you have any questions for me about anything?
I don't know. You know what you're doing, so
I think no.
should be good.
All right. Well, if you think of anything from now before we head into the OR, just let us know.
All right.
We're just gonna set up the room and then we'll see you in there shortly.
Okay. That sounds
Okay.
good.
All right. We'll see you in there then.